Hi, I am Manuel.
I'm Jessica. We live in San Antonio, Texas. We have 2 boys, Tristan and Gavin. Gavin was 5.5 years old when he was diagnosed with Duchenne muscular dystrophy.
When you get a diagnosis that is life-changing as a Duchenne muscular dystrophy, it really rocks your world. It's not just, it's a life changer for individual, it trickles out to the whole family. I remember doctor, he told us, Gavin is gonna be okay. Those kids and somebody that has a condition or a disease, they've been having that for a long time and they know how to deal with it. But it's gonna be harder when somebody is an outsider. And in this case, you as a father and Jessica as a mom, they want to take this diagnosis differently on a more personal perspective. So you need to learn to be cohesive and to really give each other time and respect those moments. Jessica really, she dove into information after the diagnosis. She went after every single forum. She wanted information. She wanted answers. She's a fighter. So she wanted to make sure that she knew all the information beforehand. On the other hand, I took the opposite reaction. I didn't want to put myself, I didn't want to learn anything about Duchenne or what was, I knew in a bigger picture what was going to happen. I didn't want to read testimonies or start looking at pictures or really real life scenarios of what was happening or what was going to happen to my son 5 years from now. So for Jessica and I, that's how it has been working. She learned to give me some space. I learned how to give her space because you have to restart as a couple.
So it was really hard in the beginning when so many people stepped back out of our lives because they don't know how to handle a diagnosis like Duchenne muscular dystrophy, and they don't want to take the time to learn about muscular dystrophy. So it was hard in the beginning, but as we slowly started rebuilding, we learned really quickly who our tribe was. And since diagnosis and shortly after diagnosis, we have a whole new village that we never thought in a million years we would have surrounding us. That is, they've become part of our family. So Myo Monsters came to us right after Gavin's was diagnosed. Gavin actually helped found Myo Monsters as the first kiddo with DMD. I was reached out to by Riot, who is Gavin's lead monster, a couple of months after Gavin was officially diagnosed. And he said, I'm a professional long-distance motorcycle rider. I would like to dedicate a day to your kid. And I was like, okay, I'm never gonna see or hear from you again. That sounds awesome. You're growing awareness for us. And I didn't think anything else of it. And then in September of 2021, Riot reached back out and told us he was gonna be at a biker convention in Dallas. Gavin doesn't bond with people very easily, but it's just like Gavin and Riot were kindred souls looking for each other. And from there, it's pretty much history. They became family. His family became our family and vice versa.
When we found out about Duchenne, really, the first months is you hope that everything is a dream. You hope that those bad news, that just one day just disappear. It's something that really attacks young kids. They really takes away the childhood. So for us was really trying to being positive, but not just being positive, just being hopeful. If we want to be in this together, let's make every little thing count. So our fear turn into fuel.
For any parent going through Duchenne muscular dystrophy it's okay to cry. It's okay to cry. It's a normal response. And yes, you may be angry in the beginning and you may think the world is ending, but it's not. It's not ending. Every day is a moment Every day is something to be cherished. When you're at your lowest, look at your kid. Just look at your kid. They're the exact same person they were before you got that diagnosis. Just love them. Love and have no regrets.
Indication and important safety information. What is aGamree? aGamree is a prescription medicine used to treat Duchenne muscular dystrophy, or DMD, in patients 2 years of age and older. Important safety information. Patients should not take aGamree if they are allergic to vamorolone or any of the inactive ingredients in aGamree. What is the most important information I should know about aGamree? Do not stop aGamree or change the amount taken without first checking with your healthcare provider. There may be a need for gradual dose reductions to decrease the risk of adrenal insufficiency crisis, which can be fatal. There is an increased risk of infection when taking corticosteroids like aGamree. Tell your healthcare provider if the patient has had recent or ongoing infections or has recently received a vaccine. Seek immediate medical advice in the case of fever or other signs of infection. Some infections can be severe and sometimes fatal. Patients should avoid exposure to chickenpox or measles. Alert your healthcare provider immediately if exposure occurs. Corticosteroids, including aGamree, can cause an increase in blood pressure and water retention. Your healthcare provider may monitor for these increases during treatment. There is an increased risk of developing a hole in the stomach or intestines in patients with certain gastrointestinal disorders when taking corticosteroids like aGamree. Corticosteroids, including aGamree, can cause severe behavioral and mood changes. Seek medical attention if behavioral or mood changes develop. There is a risk of osteoporosis with prolonged use of corticosteroids like aGamree, which can lead to vertebral and long bone fractures. Corticosteroids like aGamree may cause cataracts or glaucoma. Your healthcare provider should monitor for these conditions if aGamree treatment continues for more than 6 weeks. Immunizations should be up to date according to immunization guidelines prior to starting therapy with aGamree. Live attenuated or live vaccines should be administered at least 4 to 6 weeks prior to starting aGamree. Live attenuated or live vaccines should not be administered in patients taking aGamree. Rare instances of severe allergic reaction have occurred in patients receiving corticosteroid therapy. Before taking aGamree, tell your healthcare provider about all medical conditions, including if the patient has decreased liver function, is pregnant or planning to become pregnant. aGamree can harm an unborn baby, is breastfeeding or planning to breastfeed. aGamree may appear in breast milk and could affect a nursing child. Certain medications can cause an interaction with aGamree. Tell your healthcare provider about all the medicines the patient takes, including prescription and over-the-counter medicines, dietary supplements, and herbal products. What are the possible side effects of aGamree? The most common side effects with aGamree include facial puffiness or Cushingoid features, psychiatric disorders, vomiting, weight gain, and vitamin D deficiency. These are not all the possible side effects of aGamree. Call your doctor for medical advice about side effects. Please see full prescribing information available at aGamree.com. To report suspected adverse reactions, contact Catalyst Pharmaceuticals Incorporated at 1-844-347-3277 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.